If you test positive for COVID-19, I think the best first step is first not to panic. What we know right now about COVID-19 is about 80% of individuals will have mild to moderate symptoms. And so what that means, it may feel like the flu, you may have cough, shortness of breath, some people have fever during that period of time. If your symptoms worsen, so you have worsening shortness of breath, worsening cough, please call your healthcare provider and they can set up a visit for you either through telehealth or if you need to be seen by a doctor in person, we have places like at UAB, the COVID clinic. And that will help determine if you need to go to the emergency department and then be admitted. But for the vast majority of people, this is like a flu-like illness. You will have symptoms. It can be harder at night in particular. But most people do not need to go to the hospital. In terms of taking care of yourself at home, some of the best things that you can do, number one is help make sure that you take medicines that help your symptoms. So for instance, if you are having a fever, fever-reducing medications like Tylenol or ibuprofen may help, as long as your doctor has said that you are okay to take those medications. Rest as much as possible, take as much fluids as you can, and make sure that you stay hydrated at home. Those will all help prevent any sort of illnesses that we see in the hospital like kidney problems and dehydration. In terms of isolation, what the CDC recommends is that if you have no longer any symptoms of fever without any fever-reducing medications, and improvement in your symptoms. So if you have diarrhea, you want to see improvement in that. If you have respiratory symptoms, you want to have some sort of improvement. And about 10 days from when you first symptoms develop, then you can come out of isolation. If you are immunocompromised, which means that you're taking medications for suppressing of your immune system, or if you have something like cancer, we would recommend 20 days rather than the 10-day isolation period.